Medical professionals, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I worked as a medical oxygen technician, mostly doing in-home visits. The job was straightforward enough. Set up oxygen machines, explain how to use them, and check that everything was running smoothly. Most patients understood the basics, or at least tried to follow instructions, but there was one patient who made me seriously question how he had managed to survive this long. He was on an extremely high concentration of oxygen. So high, in fact, that if he breathed regular air without the machines, he'd be getting almost no oxygen at all. This wasn't just a little extra oxygen to help with breathing. It was life or death, supplied by 2 heavy-duty machines hooked up in tandem just to keep him barely alive. The setup was complicated, but I took the time to explain it to him and his wife over and over. Every visit, every change in his condition, every time I left, I made sure they understood the gravity of the situation. Signed documentation of every conversation was part of the protocol, but none of it mattered. They consistently ignored all the instructions. They'd shut off one of the machines because they decided it was too loud. The noise bothered them so much they just turned it off, cutting his oxygen supply in half. He'd take off his mask because it felt too cold on his face, and then gasped for air when he couldn't breathe properly. His wife would unplug the hose if she decided it was in the way, or if she needed to move something around the house. It was like they were actively sabotaging the treatment, and every action reduced the already critical oxygen levels. And then, when the inevitable happened and he started having dangerous reactions to lack of oxygen, panic, dizziness, confusion, they'd call our emergency service. Usually, it was me getting the call. I lived less than 5 minutes away, right next to the EMS and fire station, so I was the quickest one to respond. I'd rush over at all hours, sometimes 3 to 7 times a week, to fix the machines, reattach hoses, and remind them yet again why the machines had to run nonstop. But they refused to call 911 because they didn't want to make a scene. They wanted to manage it themselves, which just dragged the situation out longer and made every emergency more dangerous. I remember one night in particular. It was well into the 18th month of this nonsense. The guy was having trouble sleeping and, for some unknown reason, shut off both machines before going back to bed. I got the emergency call a few hours later. When I arrived, he was unconscious, struggling for breath. I started the machines back up, called EMS for backup, and stayed with him until the paramedics arrived. It was the closest I ever came to losing him on my watch. That was years ago now. The patient eventually passed away, which wasn't a surprise given how inconsistent their oxygen use had been. But what still sticks with me is the attitude of his wife afterward. I see her around town from time to time. She always glares at me like I'm the one who killed him, like it was my fault for enforcing the rules, for explaining the risks, for doing my job. It never made sense to me how people could be so stubborn and careless about something so serious, how they could repeatedly ignore the simplest instructions and then expect everything to be fine. And yet somehow, he survived long enough to make a lasting impression on me about the sheer willpower of both the patient and the family's bizarre disregard for his own survival. That job taught me a lot about patience and frustration, but this case taught me the limits of both. I still don't understand how they made it that far, and I doubt I ever will.